very hard to predict. Clearly we've had some interventions already, but they haven't been as complete as we would like to see in terms of social distancing. We probably should work on an estimate of 15 to 20% of the population being infected in the first wave of this particular COVID-19 epidemic in Australia. Is that going to necessarily be the case? Well, probably it will happen, but what we can do is slow it dramatically, and that's really what we want to do. We've seen that the reproduction rate, or the number of secondary cases that follow a single case, is about 2.5, and that means it can rapidly spread in the community. We can slow that down though, because we've got the advantage that this is droplet borne or on surfaces. So if we keep infected people at home and make sure that they don't go out and spread this virus, then we can get ahead of it. That's what we have to do. This is really the critical public health work that we currently are doing. What we're trying to do is track every possible case as soon as possible, find their close contacts and make sure we isolate all of them. That is our best chance of actually slowing the spread of this virus in the community. We've all seen the graphs. You either have a very sharp graph, which knocks out the health service, or we keep going as hard as we can to slow the spread, and we flatten that graph and make sure that we preserve our health service. It may mean a bit of pain for a bit longer, but it will save large numbers of lives. We know from international experience in well-developed countries that what we see there is that about 80% of cases are quite mild. 20% need health service intervention. About 5% will end up in ICU, and we know that about 1% of people will die. So if we can really flatten that curve, we'll make sure that we have the hospital surge that is necessary, the beds that are necessary, the critical staff that are necessary to provide high care and ICU care as this epidemic develops. It is really now a critical time where what we need to do is make sure that people only go out if they have to. It's inconvenient, but it's a very worthwhile sacrifice. We're already seeing that sacrifice being made by these heroes, these people who've been inadvertently exposed to the virus, who's staying at home and keeping our community safe. We all need to do that. It's now our time to make that contribution as well. Only critical workers, emergency services, health workers and others should really be working at this time to make sure that we provide the best possible care to slow the virus, but also provide care to those who are going to suffer some of the consequences of this viral infection.